Hello everyone, my name is Kumarica Dutta and I am a psychologist specializing in stress and crisis management. I have been working as a mental health professional for more than 2 years now. I'm certified and trained in different areas to provide therapy and counseling to children, adolescents and adults. Along with that, I also have certification in geriatric counseling, child psychology and crisis management, cognitive behavioral therapy and relaxation therapy. In these 2 years of field practice, I have been guiding individuals of all ages to have more resilience, to work through mental health crisis and have better mental health, and guide to enable and empower self. I would like to thank and express my gratitude to our Clear Minds for giving me this opportunity to join in this noble initiative to raise awareness about mental health and talk about mental health in most simplest form so that it can reach out to people and make a lot more difference. Thank you, our Clear Mind, for giving me this interview opportunity, and let's start with the questions. So the first question is two-folded. So the first fold is please introduce yourself as a human and a mental health professional. So the answer to that is I have already shed light upon my profession, and also I've shared a bit about myself. So let's move on to the next fold of the question. So the second fold of the question asks about my experience and volume of work. So I have been working as a mental health professional for past 2 years now, and I have been working with a diverse population and different age group, of course. Having an opportunity to work with different age group or having an exposure with different age group and people with different conditions have really enriched me as a mental health professional. And coming to volume of daily work, so volume of work depends upon the number of clients that are approaching in a day. Apart from this, I also work for a helpline where I'm recruited as a mental health professional, and I have to receive call from clients in emotional distress. During the pandemic, the call rates were very high, but now as the pandemic has kind of slowed down, the call rates are low, and yeah, that's pretty much my schedule. And we have come to the end part of the question, that is, which asks about my notable connection with an institution. Well, I am associated with one institution, that is Minecraft, which is headed by Shreya Dash. She's a rehabilitation psychologist practicing for 11 years now, and I have taken training and guidance under her and have been practicing under her supervision for these 2 years now. So the second part of the question is also twofold, and I will be answering in parts. So the first part says, when do you think anxiety is normal and when do we see a doctor? So before I shed light on the first question, that is anxiety normal, I would like to tell something about anxiety. That is, anxiety is never ever about past or about present. It's always about future. It's futuristic, something we don't have control over or something we cannot see. So from this we can conclude that anxiety is mostly centered towards something we don't have control over, and this anxiousness comes up when we feel that we don't have control over something and it feels scattered and it's vague and I don't know what the result is or what's coming up. So that is what makes us feel like, oh my god, what is going to happen, and we feel, as a result, we feel anxious. So when we feel anxious, two things happen simultaneously within us. One is the feeling part, another is the physiological part. In the feeling part, we feel very uncomfortable, unpleasant. We feel diffused and vague and scattered and apprehensive and fearful. While in the physiological part, we feel like our heart rate goes up and we feel dizzy, we feel like we will faint any moment, or we can lose appetite, or we can have diarrhea, and frequent urination, and often sometimes tremors. To start with the first question, whether anxiety is normal, when is anxiety normal? Anxiety is normal and we all have anxiety. So let's take a situation like we are waiting to give an examination. We will feel anxious. We are waiting to cross a road. We will feel a little anxious that whether I will be able to cross the road properly or not. or we are waiting for to give a speech, then also we will feel anxious. We are waiting for our exam result, we will feel anxious. And we went to a dentist to take out our decayed teeth, we will feel anxious about that. So in our daily lives, we in particular situation it's anxiety in us, and it's pretty much normal and expected out of few situations. Now you must be thinking, if anxiety is so normal and expected out of few situations, why do some people have to visit a doctor? Why? So just when we feel anxious all the time, or we feel anxious about everything, and this anxiety is not helping us to progress in our life, rather it's holding us back and is interfering with our functioning in day-to-day life. That is, we are getting late, we are not having good sleep, we are having extreme physical problems, and we are always feeling down, low. Then only this anxiety becomes a disorder. So summing up all of this, when does this normal state of anxiousness turns into a disorder? Only when it disables you and interfere with your day-to-day normal functioning of life. It is at this point you have to visit a doctor. So the next question asks that what is the difference between just worry and anxiety disorder? Well, worry and anxiety are often interchangeably used, but both hold different meaning and different states. So worry actually is a very temporary state, as because it is overly concentrated over a particular situation or problem. We are overly concerned about a situation or a problem, and it's very specific, like financial problem, health problem, marital problem, relationship problem, or any other problem. And it's very you have the control over the intensity of worrying, and also the time you will spend or invest in worrying about that particular thing. But in case of anxiety, it's very different. So worrying is not anxiety, but a piece of anxiety, and it kind of directs us to taking decisions, and it prompts us to take actions to change the situation. But anxiety is very different from worry, as anxiety is very free floating, and most of the time it's about future, and it's not grounded to present, and therefore it's not very realistic, and it always takes a person to a place where they think about the worst that can happen to them. So anxiety basically is our physical response to a perceived danger in the environment. It makes a person very hyper vigilant about the environment, and continuously they invest their time in scanning about what things can go wrong, and what are the probable dangers in the environment that they cannot control. And that is why it kind of brings overwhelming reaction to bodily as well as psychologically. And that is why worrying is just worrying and not a disorder, and anxiety, when it kind of overblows out of proportion, it becomes a disorder. So the third question is, are there any medical tests that can clarify that one have an anxiety disorder? No, there are no medical tests that can certify anxiety disorder. Rather, there are psychological paper pencil tests that can give an idea about what the anxiety is, how much the anxiety is, in which category does it fall, high, low, medium, and is it a state anxiety or a trait anxiety. By that I mean, if your anxiety is related to a particular state, that you don't feel anxious all the time, you feel anxious at particular states, and anxiety seems to heighten up at particular state. But if it's a trait anxiety, you have anxiety and anxious response within yourself, it's somewhere in your traits, and time to time and situation to situation it just comes out and heightens up. So the fourth question is, why do we feel tightness of chest and breathing difficulty when anxious, and how can we stop it? Well, the tightness of chest and the breathing difficulty that is felt during extreme anxious state is just a physical response to the danger that is being perceived in the environment. So what do we do when we are experiencing this physical response to anxiety, that is tightness of chest, breathing difficulty, and other symptoms of anxiety? So in that case, what we are going to do is we are going to use breathing techniques to make ourselves relax, because when we become anxious, our muscle gets tensed, and that is why we feel all these things. So the first thing we can do is breathe in and breathe out. So the basic breathe in breathe out technique that you can use is 4-7-8 breathe in breathe out technique. That is, with a count of 4, breathe in, hold the breath and count 7, and then release while counting 8. Secondly, what you can do when you are experiencing physical response to anxiety, that is, you can go to a comfortable space and lie down, or just sit somewhere comfortably and just take deep breath in and take deep breath out, and just close your eyes and say yourself this affirmation that I am relaxing, my body is relaxing, I'm relaxed, I'm relaxed, I'm relaxed. Continuously do this continuously until you feel a little better than you were feeling before. So the fifth question is, how long does anxiety disorder last? Can it be cured completely, or will I have issues? Well, no mental health professional can actually state how long a disorder can last or will last. It's not something that comes and goes. It is a particular condition that happens to take place for very many reasons. So the thing is, the earlier a disorder is detected, the lesser time it will take for one to recover from that condition and go back to a normal space of life where his or her life will function in a normal way. So the sixth question says, some people say that having anxiety issues is beneficial. Is it true? Well, like I mentioned in the beginning of the video, that anxiety is very common and it's expected out of few situations, and it's normal to get anxious in certain situations. Likewise, anxiety is beneficial in a way which pushes you to do better, a little better. So like if a student is anxious about his examination coming and knocking at the door, he will study. His anxiousness will make him think about the consequences that can happen, and kind of motivate him to do better or keep studying for the examination. And or a person who is going to give a speech, his anxiousness about what is going to be the consequence may help him to revise more, and little anxiety gives you that nudge to do things in a better way. So until this anxiety is pushing you to do a thing in a better way, or is motivating you to do something better, it's beneficial. But if it's kind of restricting your abilities and disabling you, then it's not. So the seventh question is, do anxiety run in families, and how can we recognize it in a family member? So to some extent, anxiety do run in families. That is, it has a genetic disposition, or in other words, it is genetic to some extent, but at the same time it is learned by observing too. That is, if a mother is continuously anxious about various things in her life, her child will kind of mirror her, because the immediate role model of this child is her or his mother. So however the mother is responding to different situation will become the reference to the child, and this child will mirror everything and will in his or her own way will respond to the situation in a similar way like his or her mother, and this will in later life can become anxiety disorder for this child, or the child might have anxious response pattern. The part question to question number 7 was, how can we identify if a family member has this anxiety disorder? So by now I think for most of us it will not be difficult to identify and recognize how an anxious person will respond to a situation. Rather, I will say an anxious person will always react to a situation and never respond. And another thing is that the anxious thoughts or anxious state will always be blown out of proportion. So that's how we can differentiate between a normal anxious state and an anxiety disorder in a family member. Another thing I would like to clarify, that is the anxiety I'm calling that is free floating and is not specific to a particular situation, is a category of anxiety disorder that's called generalized anxiety disorder. In this generalized anxiety disorder, the anxious thoughts or anxiety is not related to a particular thing. It is rather very free floating and it's about everything. So anxiety disorder is an umbrella term, and under that umbrella there are many disorders with different characteristics and the manifestations of those disorders are different. So for further information about other disorders we need another session. But in general, all anxiety disorders are characterized by the feelings of fear, worry, apprehension and physiological changes within the body that disables one normal functioning and interfere with their personal, social and occupational life. So the last and the 8th question is, can we cure anxiety disorder at home? Are there any medicines for anxiety that we can use without prescriptions? Like no disease can be cured at home. It requires professional guidance and review and testings. Likely, anxiety, when reaches to a point where we can call it a disorder, cannot be treated at home. It needs professional guidance and help and assistance to be cured or healed. So the last part of the 8th question asks about whether there are any medicines that can be used without prescription. So firstly, I would like to state something that is very important for all of us to know. There are different types of mental health professionals working in the field of mental health, and these different types of mental health professionals hold different degrees, which makes them eligible to make a different treatment plan. Therefore, a psychiatrist is a mental health professional who is the only mental health professional who can prescribe medicine, not anyone else, because a psychiatric is a doctor who has an MBBS and specialization in psychiatry. So the answer to the question is that no medicines can be prescribed without prescription and can be bought and taken without a doctor's supervision for anxiety or any other disorders. Lastly, if you feel that you're going through a tough time and you don't have enough resources that can help you to cope up with a particular situation, you must feel free to visit a mental health professional who can guide you and help you to go through this experience and work things out in your life. Before signing off, I would like to appreciate our clear minds for arranging such an amazing interview and giving me an opportunity to contribute to this noble initiative. Thank you.